So my name is Alissa Terry. I've met a lot of you over the past few years. So hi to everybody that knows me. I've been a genetic counselor for about 15 years and have been working with NYMAC for about 5 years now. We are so grateful to see so many familiar faces and new faces here today. And we're so glad you all decided to join us. I have no disclosures. So as you may already know, and likely heard from Michelle earlier today, NYMAC stands for New York Mid-Atlantic Caribbean. And we are a regional genetics network, or RGN, that's part of a whole system of 7 kinds of networks that work to improve access to genetic services, especially for our underserved families. The RGNs are supported by the National Coordinating Center, or NCC, which is housed at the American College of Medical Genetics and Genomics. We'll put the link to that in the chat below. Additionally, the National Genetics Education and Family Support Center, or Family Center, is a key part of the system. You'll hear from the Family Center during their talk at 12:45 today, and both the Family Center and NCC will be in the exhibit hall both today and tomorrow during the lunch hour. So I really encourage you to go meet them and find out more about what they do. The networks work really closely with families and family organizations. NSGC and ACMG are genetics training programs, other genetics organizations, regional healthcare providers, public health professionals, and many more. So I'd love to get a quick sense of who is on the meeting today. We'll share a quick poll so we can see what types of stakeholders are with us.
So Alissa, you may not be able to see the poll, but the answers are flying in here.
Okay.
Just so you know. We got close to 200 people on the call and over 120 people have answered. So just a few more seconds here. I bet you can guess.
I bet I can.
These numbers are shaking out. All right.
I'm going to put my money on the genetic counselors.
I'm going to close the poll. I see the numbers are slowing down here. So I'm going to close the poll in a moment. If you also want to put in chat if you didn't get a chance to answer, if you want to give more details about your role, go ahead and put that in chat. I'm going to close the poll in 3, 2, 1. Here you go.
There they are, the genetic counselors. Oh, I'm super excited to see that our families are coming in at a nice appreciable percentage. And I know we have a lot more of our physicians, our geneticists and PhD geneticists also this year than we normally have. Some public health staff, Title V, children and youth with special health care needs. So we're super excited to have a different kind of audience this year than we have in the past. So welcome to all of you, and we really appreciate you being here with us. So again, as you may have heard earlier today, our region includes Delaware, DC, Maryland, New Jersey, New York, Pennsylvania, Puerto Rico, the US Virgin Islands, Virginia, and West Virginia. We did get a quick snapshot this morning of where people were coming from, but lots more people have joined the call since we did that at 8 o'clock. So we'd love to check again and see kind of where everyone's coming from. So you'll see another quick poll come up.
So once again, Alissa and everyone, answers are flying in here. It looks like most people have answered, maybe a few extras. So if you want to give a shout out to your hometown in chat, that chat's open for that, because we have a lot of people, like before, we have a lot of people in the New Jersey, New York bucket. And of course, there's a lot of diversity of what that means to people.
Yes, but what's most exciting is that we have someone everywhere, and that we have people from as far away as Puerto Rico and the Virgin Islands. So that's amazing. We are so happy to see a little bit of distribution across all of our jurisdictions that we cover. So that is wonderful. Thank you so much. So this is our general NYMAC flyer that we share with others to tell people what we're working on each year. I know it's super busy, but it gives an overview of our mission and resources for the year, which I'll sort of walk through now in the following slides. You can find this flyer on our website, and we're going to drop the link in the chat right now. Feel free to use it yourself or share it with others. So I'd really love to learn more about ways that the audience that we have with us right now has engaged with NYMAC in the past. I am going to stop sharing my slides for a minute, which maybe is not the greatest idea, but I'm going to do it so I can see more of you. I'd love if you turn on your cameras so I can see you too. Best in gallery view, which you can find by clicking the view in the top right of your screen. I'm going to ask you, like Erica did this morning, to kind of wiggle your fingers if you have worked with NYMAC in these various different ways. So I'm going to turn that off for a minute and I can see you. Perfect. Okay, so wiggle your fingers or use the reaction button in Zoom if you have worked with us on a funded collaboration in the past. I see Dr. Scher and Barbara. Thank you. How about if you've used the NYMAC website? See Dr. Pellegrino and Andrea. How about someone who has attended in the past a webinar or other educational event that we have held? Monisha, perfect. How about people that have been to an annual meeting before this one? I see Bruce and Andrea. I know Lynn and Dana are frequent flyers at our meetings, are always there with us. How about if you have done telegenetics training with us? I see Dr. Fala and Sandra, Dr. Scher, perfect. How about anyone who's on a NYMAC team? We have Vivian and Luba, Monisha and Lynn. We have all of our co-leads of the teams today that you're going to be meeting right after this session. So that's super exciting. How about who's with us from the advisory committee, the NYMAC advisory committee? Perfect. I see Bruce Orr and Dr. Vockley and Dr. Ostrander, and Dr. Scher. Wonderful. And lastly, any students on the call, students that have collaborated with us on student projects. There's Madeline. I see Madeline. Coralise. Perfect. Thanks, guys. That was great. And thank you for showing me your smiling faces. That was fun. All right, now we're going to transition back to these slides seamlessly, I'm sure. How'd I do?
Great, 100%.
Perfect. Okay. So we really do hope that our new website will become a go-to resource for all of you. We're going to drop that link in the chat right now so you can find us online. A couple little things I want to point out. We do have a place for resources for providers and a different place with resources for families. The website also has a translation feature on the top, so you can look at it in different languages. And also on any page of the site, you can find our Find a Genetics Clinic red oval button that will take you to our directory to find a genetics provider near you. So sort of aligning with this type of up-to-date education, you heard earlier today about personalized genomics, and later in the meeting, we'll be bringing you topics on other important educational issues like patient data sharing and continuous quality improvement. We're also really increasing our efforts around social media. So far, we're doing Facebook, YouTube, and LinkedIn. We encourage you to connect with us there for current events, previously recorded content, and more. You can find our social media links at the bottom of our website page with those red circles you see there. But we'll also drop all those links in the chat right now, and we would love it if you come follow us there. So NYMAC really has a big focus on engaging with families and family organizations, and we are so happy to see so many of your faces today. I mentioned that we work with the Family Center, but we also collaborate with our regional family-to-family, parent-to-parent, and family voices organizations, among others. We got great help this year from our regional families on our logo design, our website, our social media approach, and the plans for this meeting as well. We have families that work on our NYMAC teams, lead team projects, and serve on our advisory committee. We strive to engage with their work groups also when it's helpful to them and to support their educational needs around genetics. So later today, we have some great presentations about the family perspective from the Family Center and from some parents from New York and Pennsylvania. We're also going to give you an opportunity at the end of this presentation to sign up for an email list for further information about NYMAC efforts like this one. So with many of our key partners and along with the rest of the regional genetics network system, NYMAC is increasing our focus and work around diversity, equity, and inclusion. You'll hear more throughout this meeting about our work in the territories and how their experiences can inform what we do in the continental states. These important issues are also a key focus of the NYMAC teams. We're seeking to work with more underserved communities to address unique disparities. NYMAC is engaging in work to expand minority student representation in genetics through a variety of funded and collaborative efforts. We have a focus on cultural dexterity and addressing health disparities throughout our work. We're really lucky to have engaged with some great teams of translators and interpreters for written materials and meetings like this one. And we're looking forward to continued learning from the wonderful group of bilingual genetics providers we've identified so far. We're striving to consider diversity in our social media work as well. So later today, we'll hold a very small working group that's just for bilingual providers, and we'll also have a session about cultural dexterity today. Tomorrow, we'll look forward to a session about leveling the playing field when it comes to accessing genetic services. And this is another area where we will be inviting you to share your email with us if you'd like to continue these conversations after the meeting. A key goal of NYMAC is also to be a reliable source of genetics information. So in this cycle, some examples of this work include our new website, as well as a video project that we just completed with wonderful family and provider testimonials. We're really thrilled to have an opportunity to share that video with you later today. We're also collaborating with one of our partner regional genetics networks in the Heartlands on a series of Spanish language videos for families about genetics. We'll share the link to those videos below. We're also nearing the end of a great educational effort to develop education for families in Puerto Rico about genetic services. We've created an online telegenetics program planning toolkit, and you can see that link below. We also have a series of documents about when to refer to genetics, also called red flags, and that link will be in the chat also. We try to collaborate closely with our primary care providers to address their needs, and we strive to respond to families and family organizations about their resource needs, such as a recent request for a visual aid about genetics conditions related to channels in the body, which you can see on the far right. So related to these topics, earlier today, you heard a great talk from Dr. Kim about the process of making a genetic diagnosis. And tomorrow we'll have another great session about tools and recommendations to strengthen the primary care geneticist collaboration. NYMAC really increased its focus on telehealth as a strategy to improve access to genetic services about 4 years ago. Over this time, we've provided one-on-one assistance to 130 of our local providers about the use of telehealth in genetics or telegenetics. We've been able to provide training for providers about telegenetics in collaboration with our colleagues in the Western states to over 75 providers and students, including a lot of you here today. And we've funded 10 telegenetics efforts over this time who have really demonstrated big increases in the progress of their program plans. As you can all imagine and lived yourselves, I'm sure, the demand for these resources increased tremendously when the world adopted telehealth about a year ago. Over the past 3 years, we collected data. We definitely saw big increases in our one-on-one support, education, training, and the number of sites that were offering telegenetics. On the far right, you can see that we went from about 10 patients seen by telegenetics 3 years ago to about 700 2 years ago, and then over 3,500 last year. Tomorrow in the meeting, you'll get to hear more about telehealth from our collaborating federally funded telehealth resource centers in the morning, and from 2 of our regional geneticists about their experiences in the afternoon. I'll also note that the 2 telehealth resource centers that cover the NYMAC area will be available in the exhibit hall both today and tomorrow. I encourage you to go chat with them about their resources. Intelligenetics is another area that we'll invite you to share your email with us for further information. So lastly, I want to mention one of our newer efforts, our NYMAC teams. We strive to form a team of diverse collaborators in each of our 10 jurisdictions that we cover. We try to make these groups represent a lot of different perspectives that help us really understand how the genetic system is working or not working in that state, district, or territory. So we invite genetics providers, families, other healthcare providers, training groups, groups from maternal child health, newborn screening, Title V, industry, insurance, and others to join us in this work. In this grant year, and that means for us ending May 31st, we launched NYMAC teams in the District of Columbia, New York, and Virginia. Coming soon, we'll start work in West Virginia and Maryland, and in year 3 in Delaware, New Jersey, and Pennsylvania. I will also add that our efforts in Puerto Rico and the Virgin Islands are being led by our colleagues at Family Voices and will run for all 4 years. In contrast to that, our continental US teams spend their first year focused on defining the key challenges to accessing genetic services with a focus on underserved populations, distance barriers, or education. The teams then brainstorm possible solutions and create a project plan. In the second year, they implement their chosen project to improve access, and then in later years, they look for further opportunities to monitor and impact access to genetics. So right after this session, we're going to lead right into it. You'll hear from the co-leads from New York, DC, and Virginia teams about their experiences and plans. And then tomorrow, you'll hear about the great work being done in Puerto Rico and the Virgin Islands. And again, the NYMAC teams is an area that we'll invite you to share your email with us if you want to look into further collaboration with NYMAC. So with that foundation in mind, what we'd like to do now is to transition into small discussion groups to consider some important questions. We invite you to discuss in your group what you see as the biggest barrier that families experience in accessing the genetic services they need, and also what could be some key solutions to those barriers. When you come back, we're going to ask you to share one-word responses to both of these questions, which we'll visualize in a word cloud, which Dr. Kim did so nicely this morning, and we'll reflect on those together. So Fred is going to help us get to where we need to go, and we'll come back here in a few minutes. Great. Well, I hope everyone had a good discussion. What we're going to do now is a word cloud, which is what we did this morning also. So if you guys can share with us one-word responses to what you feel is the biggest barrier to families accessing care, we can get sort of an idea of what different people are observing out there. So you'll see the link in chat, and then you just click on that and answer. So the new word for this year is definitely broadband internet access. Those were not important words before when we thought about what was keeping families from coming to clinic, but now it's huge. And it certainly interacts with distance as well, because telehealth can be a solution to a distance problem, but then you have to make sure that you're addressing the internet and broadband problem if you really want that to be a feasible solution. Cost, for sure. Cost probably the most challenging one for us to influence and impact in a meaningful way that will really help families. And transportation really similar to distance in the sense, although not always, because we do hear also from families in cities that even if you're 3 miles away, that getting from your house to the clinic can be a nightmare if you don't have the appropriate kind of transportation. These are all themes that we have seen before, and we really appreciate you sharing with us these ideas, and we're going to carry these ideas forward into the next session where we talk to the state teams. So we had one more question to ask you through another word cloud, and that was about, now that we've thought about what the barriers are, what are the solutions that come to mind for you when you're thinking about how to make these things less impactful to families? So the link again will be in chat. Yeah, we see education as a big issue, both for families and for the providers that send the families to us, and the genetics providers too. Yep, physician education. Equity for sure. The wait time, yeah, quicker appointments. Wait time is always an issue in genetics, and families often have to wait way too long to get to us and spend a lot of time wondering what's happening. Financial assistance for sure to help with that cost issue. Libraries with computers is a great answer. We've seen that happening a lot. I actually was thinking about it when I was in my local library the other day, is asking them if they were providing a telehealth room. I think that would be a great thing for most of our communities to pick up to help us address those broadband and technology issues. Subway ads, that's a great idea. Never thought about that before. Maybe NYMAC should think about that. I love that idea. Parent education. Education seems to be the big one, and telehealth too, which are both things we're going to spend a lot of time, as well as equity. Those are 3 big themes that we have going throughout the whole meeting. So that's great news that we'll get to talk about some of the solutions that seem most pertinent to you guys. Okay, so I am just going to wrap up now. We're going to hop over this one and just land here. So thank you so much for your time and attention and participation with me today. It was so great to see and hear from so many of you. I really want to invite all of you to join us in our mission in whatever way makes sense for you. We'll be available, NYMAC will be available in the exhibit hall today and tomorrow over the lunch hour for any questions or discussion. Please come see us there. We'd love to see you join a NYMAC team, share a resource with us, tell other people about NYMAC, attend more meetings and trainings, use our website, our tools, our supports for telegenetics, and please follow us on social media. Our website and contact information is here. But right now, we're going to share a link in chat where you can indicate your interest in learning more and working with NYMAC on key topics that we just discussed. So if you click on the link in chat, it will take you to a little collection page, and you can tell us which topics you're interested in and leave us your email and we'll follow up. So I'm going to give you a minute to do that, and then we are going to transition to hearing from our wonderful NYMAC teams.